What is the half-life of radioactive iodine therapy, RAI? Have you ever wondered about the half-life of radioactive iodine therapy? This therapy is commonly used to treat thyroid disorders, especially hyperthyroidism and certain types of thyroid cancer. The isotope most often used in this treatment is iodine-131. Its physical half-life, which is the time it takes for half of the radioactive substance to decay, is approximately 8 days. This means that after 8 days, half of the iodine-131 will have transformed into a stable form. However, when we talk about the effective half-life of radioactive iodine in the body, things get a bit more complex. The effective half-life is shorter than the physical half-life because it takes into account not only the radioactive decay but also how quickly the body eliminates the iodine. This elimination process can vary significantly from person to person based on various factors, including the patient's thyroid tissue status and the specifics of their disease. For patients treated for thyroid cancer, especially those who have undergone total thyroidectomy, the effective half-life can vary widely. It is generally shorter than the physical half-life due to faster clearance from the body. Studies have shown that the effective half-life can range from about 4 hours to over 50 hours, with many patients having a median effective half-life around 12 to 14 hours. On the other hand, patients with more residual thyroid tissue or metastatic disease may retain the radioactive iodine for longer periods. This retention can lead to effective half-lives that exceed 56 hours, as the iodine is absorbed and held in the remaining thyroid or cancerous tissue. For those treated for hyperthyroidism without cancer, the situation is a bit different. These patients often experience slower clearance of radioactive iodine, leading to effective half-lives that can extend up to 5.5 days. This reflects how benign thyroid tissue handles iodine differently compared to cancerous tissue. Understanding the effective half-life is crucial for several reasons. It helps determine how long the radioactive iodine remains active in the body, which in turn influences radiation safety precautions, the duration of isolation needed after treatment, and the strategies for dosing. In summary, the physical half-life of iodine-131 is around 8 days, while the effective half-life can vary from a few hours to several days, often averaging around 12 to 14 hours in thyroid cancer patients. Individual factors such as age, the extent of thyroid tissue remaining, and the presence of extrathyroidal disease can all influence these durations. This variability highlights the importance of personalized assessment during radioactive iodine therapy to ensure optimal treatment outcomes and safety measures. Always consult with healthcare professionals for tailored advice and management regarding your specific situation.